Welcome to Payment Matters. I'm your host, Jeff Lin. Thanks for tuning in. On the show, we talk about the ever-changing landscape of healthcare payments and the impacts to healthcare payers, providers, and consumers. You can follow the conversation on Twitter at hashtag Payment Matters and follow me at Jeff B. Lin. I'm really excited today. My guest for today's episode is Sidney Haitoff, CEO and co-founder of mishe. Sidney, it's great to have you on today's show. And, for the guests here that are listening in, can you tell us a little bit about yourself and your experience?
Jeff, thanks for having me. My name is Sidney Haitoff, CEO of mishe, as just mentioned. mishe is the pay-as-you-go healthcare marketplace where people can shop for and purchase medical care without insurance. And mishe, for anyone who's wondering, is short for Misha Bayrock. It's a prayer for healing. And I started the company to bring healing to healthcare. And I'll give you a little bit of the mishe's origin story in a minute, but I think it'll help to give you some context regarding my background as you requested. I went into healthcare right out of college in 2011 and worked for my father's billing company. It was right in the wake of the HITECH Act and all that money, incentive money being pumped into electronic health records and the adoption of electronic health records and meaningful use and reporting, meaningful adoption of those records. And so I went on with their company and ended up building out their EHR offering and meaningful use offering, and ended up extending my assistance into helping with government quality reporting and helping our provider organization, physician clients, maximize the incentive money that they were able to get from the government. And that turned into a position with a more national firm and managing their business intelligence team, creating data analytics tools for their provider and hospital clients to help them maximize their revenue in their businesses. And kind of all the while in each of those roles, I was helping direct business strategy and helping lead teams that helped those clients, providers, across most specialties and most states across the country, help them maximize their revenue and profitability for their businesses. So I feel like I aged myself a little bit, but I'm a 10-year veteran at this point of the industry, and specifically of the reimbursement and practice management side of the industry, and have seen, unfortunately, firsthand how the managed care system that prevails in our country works to delay and deny care and reimbursement and harms the providers and consumers that it is in place to benefit. So just to give you a sense for how mishe came about, around the time when the Affordable Care Act was released and we saw the rise in deductible amounts and carriers starting to transfer more patient responsibility, transfer more of the financial responsibility for medical bills to the patient. I had clients, provider clients, practice managers coming to me from across the country looking for assistance crafting these cash pay fee schedules to offer people who were coming into their offices either without insurance or customers wanting to kind of forego or not go through their insurance. And those clients knew the difference between the bill charge, the amount that you would see on a charge master, what they called their fee schedules. They were aware that those rates were a lot greater than they were receiving, and that they were contracted with insurance carriers and wanted to essentially provide some level of a discount and similar discounts to what they were giving to the insurance carriers to those consumers, that either didn't have insurance or didn't want to go through insurance. And so it was around that time where I started to realize that, one, there was a huge discrepancy, and two, based on the fact that the bill charge was really just an inflated amount, that it would be nice for everyone to be able to kind of access the care that they desired at that contracted rate, at negotiated rate, also referred to as the discounted rate. And so that's where the idea for mishe was born, wanting to give people, access to the care at what I call and feel is the true cost of care, a more reasonable and fair cost, and frankly, the actual cost that providers are paid from insurance carriers, without needing to, pay for premiums that come with standard insurance coverage.
Got it. I mean, clearly you're seeing this big demand, and you've been. I think you and I had the fortunate opportunity to meet 10 years ago. I think when we were at an event here, and clearly things have evolved. And so, interested in your point of view here, which is like you've been in the business for quite some time. Sounds like your family's been in there for quite some time. What's changed? Are things over the last 10 years? Are things getting better? Are things getting worse? What's your perspective on that?
What changed? I think the biggest change that we have seen is the continued increase of insurance premium costs and the continued increase of deductibles and the continued shift of responsibility away from insurance carriers to patients. And it doesn't seem to be slowing at all. Again, insurance, and I'll also say, along with that, the continued decrease in downward pricing pressure on provider reimbursement. It doesn't seem to be slowing up at all, and it's caused a lot of problems, whether it be physician burnout because doctors are trying to offset the downward pricing pressure with an increased volume, or issues on the consumer side where some people aren't able to afford health insurance and feel like they don't have access to care as a result. I think things have gotten worse over the course of the last 10 years, and it's kind of unfortunate to see that there hasn't really been any considerable foundational change made. And so that is what we're looking to introduce to the marketplace with mishe. We want to take healthcare from a system of delays and denials to equity and access, and from surprises to transparency. So I think that's if one could ask what the biggest problem in general is with our industry, it's the fact that there's a lot of secrecy and unknowns with regards to pricing. And I feel like that doesn't exist in other industries. In no other industry is it so difficult to identify what the actual real price of a service or good will be. And I feel like over the course of the last 10 years and probably 30, 40, 50 years, people and our country in general has grown accustomed to that unknown and being okay with that unknown. And I think that has, I don't know that it's necessarily changed, but I think that it's grown to be more of a problem as those other factors that I mentioned earlier have also grown worse and have exacerbated.
Got it. As I kind of think through this, when I go to a dentist or go get my eyes checked out, I know exactly, how my dental or vision insurance is going to pay or provide discounts on my contacts or things for my dental services. And this, makes sense here, right? I think dental and vision has figured that out. Why don't you think that has been able to be scaled out to call it the non-elective side of the house? Like, what are the barriers? What are the issues you see there?
So I think there are a few barriers. One, and I would say this is one of the primary, if not the primary barrier, is just lack of knowledge of pricing. I feel that there's a very limited number of people in the industry who are actually aware of what the true cost of care actually is, what doctors and providers are actually paid for any service, whether it be dental or vision or standard hip replacement surgery or even spine surgery or any type of shoppable service, and even services that you might not think are shoppable but truly are, just based on their nature. I think it all comes down to lack of awareness of price. And I think that, one, I know that not a lot of people, are privy to that information, just because I've talked to plenty of providers, doctors who have these contracts in place with insurance carriers, and they don't know themselves what they're actually getting paid and what they should be getting paid. And so that, I think, is one of the biggest issues. The other is, I think that we're in an industry of gross fragmentation. I think that data and care also exists in and is delivered in a lot of silos currently. Yes, there's been a massive trend towards consolidation and integration in healthcare over the last 10 years. But I still believe that even within those integrations and that consolidation, there's still a lot of fragmentation. And we've seen it with the desire to improve interoperability, because again, data and a lot of consumer information and patient information exists in silos. If we were able to kind of have providers communicate and collaborate in a more efficient and streamlined way, and understand all the different moving pieces that go into delivering an episode of care, whether it be a complex surgery or your basic, let's say, mole removal, I think that would make for a much easier care consumption process. And I think that it would make the concept of transparent pricing and frankly streamlined care access a little bit easier. It would just make it easier.
Yeah, and this is an interesting topic here, which is, as you see these, clearly these problems are apparent in terms of being able to be transparent in terms of the pricing. Are there certain specialties in healthcare that are more inclined, that would be better suited for these transparent? And I'll give it, as I kind of think through this here, like, if I break a bone and I need to go see the ER, I'm probably not shopping for services, or I'm just going to go to the nearest ER to get that. Right? May or may not be the right time to sit there and pause on all this stuff. But maybe I'm wrong and interested in are there certain things where this problem is really large and it's well suited for this model that you're describing?
So I don't disagree with you that if your bone is popping out of your skin, that you should head to the ER. But where I do think that there's an opportunity is in the pricing of the services that you would receive in that ER. I don't see there being much of a barrier to making transparent the cost of the care that you would receive. The price transparency requirement that took effect in January of this year required that hospitals across the country post their cash pay rates and their insurance discounted negotiated rates publicly in machine readable format on their websites. And most of the hospitals across the country have been notoriously slow to adopt that. But that requirement is evidence of the fact that regardless of the service that is being rendered, there is awareness of what the average price or what the average cost is and should be. And it's just a matter of those data points, that information being made public and being adhered to. I think that one of the issues there is the variation between what some payers pay providers and what other payers pay, and you read stories about, and even in the context of the price transparency rule, there are a lot of articles out about the gross discrepancy between not only the billed charge and the contracted rate, but the contracted rates even within given facilities. So I think that there are some pockets of care where it's easier to shop and it's easier to schedule care and it's easier to budget based on price. But I do also believe that because of the way that the system was set up initially, and being that there is a current procedural terminology code for or a DR diagnosis related group for every single episode and procedure that exists, that it is possible for the pricing to be made transparent. Might not be possible to shop prior to, but it's most definitely possible for the fair price to be published and adhered to and committed to in a way that would not harm and cause as much bankruptcy and pain as the current pricing system has for thousands of people across the country, if not millions.
Got it. I mean, this is great. And if you're just tuning in, you're listening to Payment Matters. I'm joined by Sidney Haitoff, and we're discussing really healthcare costs, transparency, and really kind of how we can make healthcare better for consumers and providers. So this is interesting as you look at this. There's clearly value for the consumers as you're talking about this from I think you highlighted that transparency, but also on the provider side, you highlighted delays and denials. And maybe talking a little bit more about this company that you founded, how does it help on the delays and denials? How are you able to kind of circumvent things or issues that these providers are seeing today?
Sure. I'll give you a quick sense for a little bit of the workflow. With mishe and our pay-as-you-go healthcare marketplace, we help providers set cash pay rates for the services that they offer. In a lot of instances, they already know what that cash pay rate should be, just because, again, cash pay, self-pay, direct care, however you'd like to refer to it, is not such a foreign thing in our industry. It's just hasn't caught on and isn't the prevailing trend with regards to payment and reimbursement. But we help them set those rates if they need the help and publish those rates on our marketplace where consumers can shop for and purchase care upfront. And so it's that upfront payment that reduces and frankly eliminates most of the billing costs and administrative costs and overhead that cost providers today upwards of 20, 30, 40% of revenue. And that's the pain, part of the pain that I'm proud to be addressing. I watched and frankly, worked to eliminate or alleviate some of that and mitigate some of that pain on the hands of providers or for providers in the revenue cycle side of the industry, and trying to maximize reimbursement for our providers and deal with the regulations and help them navigate the rules and requirements that seem to only increase year over year. But with our pay-as-you-go model, consumers get the benefit of the transparent pricing at rates that they would otherwise likely pay towards a deductible, if not better. And we collect upfront payment on behalf of providers, and providers get paid out once the services are rendered. And so we're able to provide them with their payment in full upfront so that they don't have to go chasing after the money that they earned and deserve. And that eliminates a lot of the pain and uncertainty that causes a lot of stress among providers today. From what I've seen, and this is publicly discussed, is that there's a lot of burnout, and providers are increasingly making decisions to shift away from healthcare and reporting that they don't know that healthcare and going into healthcare and becoming a medical provider was the right move, not because they don't see the value in helping other people. I know all providers who get into the healthcare space and become doctors and clinicians do so because they want to help people, but you have to be able to pay the bills. It has to be a cost-effective road that you're going to go down for it to make sense. And so because of the issues that a lot of them contend with, whether they don't have the resources behind them to maximize their revenue, or they just don't have the wherewithal, the ability to stay on top of all the additional requirements and costs, I know that a lot of the pain that providers deal with in the industry and the burnout and issues with patient relationships, it comes from the reimbursement side of things. And so we're happy and I'm proud to be addressing that problem, and in a way that also helps consumers. It's a beautiful thing that we're able to address the issues on both sides of the marketplace and really trying to drive value for everybody. Whether you have insurance, whether you don't have insurance, we're, because of the savings that we're able to help providers realize by collecting that upfront payment, they're able to pass along some of that savings to the consumer because they don't have to expect to spend 30% or 40% on 40 cents on each dollar. They're able to pass that savings on to the consumer, which only results in cheaper prices and more affordable rates for consumers, which has been a huge problem in our country with regards to healthcare in general.
Got it. And I get that. That makes a lot of sense here in terms of how providers benefit here. As I kind of look at this, which is if I go to a retailer and go buy a TV and it breaks, I can go back and return it, right? So there's the, I call it the retailification of healthcare. And this is I think you also alluded to that earlier, is the pay-as-you-go model, right? How does quality, and it's hard to, it's sort of like, I'm not really buying a product, but you're buying a service, and in this model here, how does quality and fall into this? How are you approaching that particular question that you get from consumers, right? Like they're using Yelp and they're using other things here to assess healthcare. And what's your thoughts on that?
So great question. It's one that comes up quite frequently, and the answer is, we're working to allow for the first time the ability to correlate quality with price in healthcare. That's something that is largely lost in our industry, the ability to connect and relate the quality of care that you receive to the price of the care. And because we're bringing the free market principles to healthcare by allowing and enabling providers to list their services and at the rates that they choose, and allowing consumers to purchase care at the rates that they choose, we're allowing for true kind of free market equilibrium in a way that helps consumers and really helps dictate the prices of different services based on quality. So you might have, for example, maybe you'd pay a little bit less for an office visit being seen by an MD than you would by a nurse practitioner, because the medical doctor might have more specialized experience and has gone through more rigorous training and frankly has spent more money on that training and education. And so the market bears a greater price because of that added level of expertise and experience that they bring to the table. And so, yes, that does exist to some extent today with, in the insurance coverage model, but we're taking it a step further to be able to then also, with reviews on our platform, which we will be integrating, whether it be reviews from consumers or also in some instances reviews from providers, similar to how you would see in other platforms, other marketplaces, and other industries. We're able then to help consumers and providers make better decisions based on those reviews. So, consumer might choose to go to a provider that might be, a little bit further away from them, distance-wise and region-wise, because that provider has better reviews than a provider that was in their closer area. And in that instance, it might not even come down to price. Those two providers might charge the same price for the same service. And if one has better reviews, then that consumer cared about the review and cared about their perceived quality more than they cared about the distance or potentially the price, then they would make their decision based on those factors. But you'd also have some consumers who might not care as much about a review, that maybe the provider has a little bit lacking bedside manner, and the consumer has a little bit more thicker skin, and their priority is on getting the care at the best rate because they're sticking to a budget. We're able to help them make that decision because of the pay-as-you-go and free market model that we're facilitating in healthcare. And it hasn't been done before. There are, again, a lot of articles and there's a lot of dialogue in the industry about the lack of correlation between price and quality. And not only when it comes to reviews and that you would see online with regards to patient satisfaction, but we will also want to take it a step further to allow for and incentivize consumers to participate in outcomes surveys, to really get into the nitty-gritty of allowing for providers to be judged in the market based on the clinical efficacy and the success that they have in actually resolving care. And so, not only allowing patients to shop based on satisfaction and high level bedside manner and the reviews that you would see on Google or Health Grades, but also taking that next step to really being able to and facilitate the correlation between outcomes and prices by incentivizing consumers and patients participate in those surveys that help understand whether or not a provider or a service is actually helping from a clinical perspective.
Got it. Sidney, it's exciting what you're doing, and really, really looking forward to how you can change healthcare in the future. And for all you listeners, those are the payment matters we're tackling today. Thank you to my guest, Sidney, for joining me today. Sidney, where can our listeners go to learn more about you and your company?
So our website is www.mishe.co. We're on Instagram at mishe, mishe.co. We're on Twitter at mishe.co. We're on LinkedIn. We are also on TikTok, trying to maximize our presence in an omni-channel way. And you feel free to reach out to us directly via email at info@mishe.co. Again, that's info@mishe.co. We would love to hear from you, providers, consumers. We'd love to hear your thoughts.
Great. And thank you once again for joining me today. And thank you to all of you listeners for listening in. Remember that you can listen to this episode weekdays at 4:30 a.m., 12:30 p.m., and 8:30 p.m. Eastern. You can also listen to this on Apple Podcasts and Google Play Music, or just say, Alexa, play Healthcare Now Radio. If you have a comment about the episode of the show, follow hashtag Payment Matters or connect with me on Twitter at Jeff Lin. You can learn more about the show at healthcarenowradio.com or at insmed.com. Until next time, I'm Jeff Lin.